Okay, good afternoon for all of us. Assalamualaikum. For the first time, I will say thanks God that give us health, time, and prosperity now. And then I say special thanks for an honorable speakers, Professor Chayushu, MD, PhD, CEO of International Medical Service Center, National Taiwan University Hospital. Special thanks to our honorable speakers, Professor Matthew Wiming, MD, PhD, Professor of Emergency Medicine, National Taiwan University, Vice Superintendent, National Taiwan University, Hospital Unit Branch. Special thanks to all crew in National Taiwan University. Special thanks to our audience as a academic health system in Indonesia. In this time, we will get the hospital collaboration webinar with the interesting topic, concerted community effort, how did Taiwan do it? Before we open the meeting, I will read the schedule for this day. For the first is opening remark from Yushu MD PhD, CEO of International Medical Service Center, National Taiwan University Hospital. And then we listen the presentation from our Professor Matthew Wee Ming Ma, MD PhD, Professor of Emergency Medicine, National Taiwan University, Vice Superintendent, National Taiwan University, Hospital Unit Branch, with the topic, a concerted community effort, how did Taiwan do it? And then we hear the presentation from Mr. Kun Hisai, CEO of Imedi Plus, with the topic, new trend of telemedicine in 2020, digital stethoscope application in critical care medicine. And then we continue with the discussion in 50 minutes and with closing remark from Chia Yushu. Okay, for in this time, I will introduce the speakers. First speaker, as an opening remark, Professor Chayushu, MD, PhD, CEO of International Medical Service Center, National Taiwan University Hospital. For opening remark, time is for you.
Hello.
Thank you.
Good afternoon, ladies and gentlemen. Can you hear me?
Okay.
Yeah. Good afternoon. Good afternoon.
Arif, dear colleagues from Indonesia, it's a great pleasure to hold this webinar again with two experts from Taiwan and also experts from Indonesia. I hope during this pandemic era, we can help each other, collaborate with each other, and to help patients in our hospitals. Today, we will have two speakers from Taiwan to introduce what we have done in this pandemic and also the new technology about the digital stethoscope for the new trend of telemedicine in 2020. So it's our pleasure again to welcome all the attendees on the internet, and I hope all of you are keeping healthy and have a good day. So let's welcome the first speaker.
Thank you, Professor Chayushu, for the opening remarks. Okay, then we will listen the presentation from Professor Matthew. Professor Matthew, he has lot of experiences. Chair of Asian Association of Emergency Medical Services, Adjunct Professor, Institute of Preventive Medicine, College of Public Health, National Taiwan University. Professor, Department of Emergency Medicine, National Taiwan University. Attending Physician, Department of Emergency Medicine, National Taiwan University Hospital. And we can read the journal and the expertise from Mr. Matthew, more than 12 pages, so I cannot read them all. So many experiences. So for the time, I think Professor Matthew can present the presentation about a concerted community effort. How did Taiwan do it? The time is for you. Thank you.
Thank you, Professor. Can I have my slides?
Yes.
For 50.
Oh no, 自己来。Good afternoon, friends from Indonesia. I'm Dr. Ma from National Taiwan University. I'm very honored and privileged this afternoon. And I hope to share with you how Taiwan reacted to the pandemic that resulted in one of the lowest number of infections in the community and the rather preserved social and economic activities. So look at this map. Taiwan is an island of 43 million people just off the coast of China, was predicted to have the second highest important risk of any country, with the proximity with China and almost 800,000 people living, studying, doing business in China. The rather small number of COVID-19 in Taiwan was only 489 yesterday. Is rather extraordinary. And when we look back during the pandemic period, the school remains open, the economy remains open, the streets are bustling, and even the baseball games resumed very early in May.
Sorry, Professor Matthew.
Yes.
I cannot see in the screen here.
Yes.
Your presentation.
Oh, sorry. Let me check with our tech people. 你有 share slide 吗？要点左边那个，对。Yeah. Is that okay? Can you see now?
Okay, see, good. I can see in the PowerPoint now.
Okay, I think I should restart again. So this talk is rather about how Taiwan reacted from the community perspective. How did we do it to contain the number of COVID-19 to less than 500? With the background that we're so close to China, there are estimated 800,000 people living, studying, and working in China with so frequent travelings and communications. And yet we have only 489 cases, confirmed cases up until yesterday. This is really special, and I would like to share with you what was behind all these efforts that made this possible. So although we're practicing some social distancing measures, the school remained open throughout the pandemic, and the business are open, the streets are bustling, and the ball games are open. So Taiwan is hailed as one of the best global response to COVID-19. And so how did the community in general do it? I think we can summarize Taiwan's success so far in containing the pandemic into three elements. First is the preparation and early action. Second is a centralized command system. And third is the wide use of big data and technology. So from the hard lesson we got in the 2003 SARS pandemic,
Taiwan has overhauled the national pandemic response systems and always on very high alert for emerging epidemics. So from the right bottom picture, you can see the capacity of the Center of Disease Control was greatly improved after the SARS epidemic, with central monitoring system implemented. And every year we conducted drills for new emerging pandemics every year in the communities. This is a very interesting story. This is happening on December 31st, 2019. In the midnight of December 31st, 2019, the deputy director, this gentleman here, browsed the Taiwan Reddit discussion group, and he came across a posting about the cluster of atypical pneumonia caused by coronavirus in Wuhan. And in this internet posting, it contains some of the health department guidelines, clinical information about this new pneumonia. It also contains the CT scanning and also some of the laboratory findings of this new disease. So that made Taiwan CDC on very high alert. They are very suspicious of something going on in Wuhan. So in the very same day, on December 31st, Taiwan CDC started border control and onboard quarantine for all the flights coming out of Wuhan. So this probably is the first measures, traveling control measures among all countries. And also during this same period of time, some of the travelers, we sent an expert to Wuhan. He also noticed the potential of human-to-human infection as early as January 15th. So when we compare all the actions from different countries during the epidemics, from Taiwan, China, Japan, Korea, those in the Asia-Pacific region, and those in Europe and America, you could see pretty much we are doing the same thing. We had first COVID-19 cases, the economy responses, mass rationing. So we're pretty much doing the same thing like any other country in the world, but only that Taiwan started very early. As I mentioned, that we started border control and onboard quarantine as early as December 31st. So this very early action, I think, really make a difference.
Very early action makes difference.
So a series of quarantine actions from different countries in the early stage were implemented for the inbound travelers. This included booking the quarantine hotels, started onboard quarantine and home quarantine notice, fever screening at the airport, and we also arranged special transport service, is quarantine taxi service for those people who need transportation to their quarantine location. And we have a very comprehensive home quarantine services for 14 days. 可不可以把他们的麦克风关掉，不然这个声音。Oh, okay. Okay. So in this slide, you can see we have a very comprehensive home quarantine and isolation services for inbound travelers. So they will be contacted by civil officers or health officers and monitored twice a day to detect any possible symptom onset. And they were also under electronics security monitoring system to track the location and the health status of these quarantined individuals subject to home quarantine and isolation. Very early from the SARS epidemic, we realized the importance, the strategic importance of masks. And this is also later ratified by the WHO You can see the incidence of disease epidemic among those countries with mask policy and without mask policies. Later during the epidemic, the WHO also issued advices to wear masks in public areas, especially when social distancing is not able to be maintained. Realizing the importance of masks, as early as January 24th, Taiwan started this export ban on surgical masks. We also assembled a national team to gear up domestic production of surgical masks. So the early production of surgical masks was 1.8 million in early January. It was boosted to 16 million in April. Quite a large increase. It was not, this was only possible by the national team that integrated the raw material, the machinery, the production line, and later on I will introduce to you the distribution mechanism of surgical masks. Then the second most important element for Taiwan's success was the centralized command system. So Taiwan officially activated the central command system on January 20th, which allowed coordination of various ministries and to enact policies and strategy already in place. There are over 200 new regulations and responses promulgated by the central control very rapidly after the start of the epidemic. These were made based on our prior experience of SARS epidemic, and they include isolation service, the supply of PPE and other material, the prohibition of disseminating disinformation measures, recruiting specialists for Taiwan CDC measures, promoting international collaboration. We also amended the Communicable Disease Control Act so we can trace and monitor disease very early. We mobilized medical care institutions and try to galvanize the number of isolation rooms and the ventilators. We enhanced the hospital infection control measures. We started the control for inpatient, outpatient, emergency patient traffic flow. And there's a standardization of communicable disease surveillance and reporting. Finally, is an optimization of border quarantine and health checkup and TOCC history for all those visitors. Since the early day of the commencement of the control center, the Ministry of Health, this gentleman here, he press conference every single day. He explained reason behind all the measures. He clarified rumors and answers questions every single day. So in the later half of the epidemic, the pandemic, his approval rate is as high as 90%. It's really, really high. The central command laid out instructions for social distancing measures such as these, and very fortunately, we never need to impose a major lockdown. Very frequent transparent communication and education from the central command won public trust. In responding to the calls for mass screening, the commander-in-chief himself became an epidemiology professor and explained why a large-scale screening practice in a country like Taiwan, where we have very, very low prevalence level, is probably not a good idea and could lead to very high false positive results. In addition to the facts, science, and the information delivered, the Central Command were successful in conveying sense of empathy and humor. One day when they learned a boy in school was bullied by fellow students for wearing a pink mask. The Central Commanders, they all wore pink mask in the afternoon conference to support the boy. A pandemic hotline was set up very early by the CDC to respond to all inquiries related to the coronavirus. And this dog is a mascot dog, Shiba Uno. All pertinent information was translated into a command from this mascot, Shiba Uno. And humor is widely used to dissolve rumors. So I explained what's in this ad. And this very amusing ad, we see the buttock, the rear end of our prime ministers. And it says, we only have one pair of buttocks. It is released because there was a rumor early in the pandemic that because we are producing a lot of the surgical masks, the raw material of tissue paper will be used up. So people got panic buying and hoarding the tissue paper. But with this very humorous ad, we stopped the hoarding and panic buy of tissue paper in just a few days. The third important part of the efforts from Taiwan leading to the success is the use of big data and technology. And many of these actions were made only possible by Taiwan's integration of our national health insurance program, the big data, and the IT technology. So we issue a name-based mask rationing, and it was made only possible because we produced a mask map. Actually, there are a lot of, actually over 130 different IT tools, apps, programs developed out of private and public entities, which based on the National Health Insurance Program. This is a dashboard showing the supply and stock of surgical masks, which we consider very strategic early on in the pandemic. So this example of a mask map, there are actually quite a dozen of these. So people using their mobile app can easily find out where they can find nearby drugstores and achieve their rationed surgical mask. And the gray color is for adults, and the red color, the pink color is for kids. It's very self-explanatory. And later on, during the epidemic, you can get your own version, your rationed mask using the National Health Insurance card and get them at the convenience stores and the local pharmacies. To protect the hospitals and healthcare system from travelers coming from other countries, as we recall, very early during the epidemic, the people who are at very high risk are travelers coming from abroad. So data from the National Health Insurance and the Immigration Agency were linked to identify patients' 14 days travel history. So we can identify very easily one of our patients or visitors coming to the hospital have a past history of traveling abroad. And this is made available to all hospitals since mid-February. And in March, this is also made available to all our EMS crews so they can easily identify this risky patients. And so this is the system in our hospital. So whenever you enter the hospital, you need to provide your TOCC. And you also check your ID cards. When it shows a green sign, you're okay to get in, meaning you don't have any risky TOCC identifiers. An electric fence system has developed over mobile phone signals from late January to mid-February. It checks individual locations every 10 minutes and reports any violations for those people who are supposed to stay at home or the quarantine hotel under their quarantine period. And the system has a capacity to monitor up to 100,000 individuals at the same time. you can see it contains a linkage between the customs, the quarantine services, the police, and health bureaus. And this electric fence system became the IT skeleton of the comprehensive home quarantine tracking and enforcing system. The famous or infamous Diamond Princess cruise also docked in Taiwan overnight. So we used the electric fencing system to conduct the contact tracing of passengers during the Diamond Princess docking in Taiwan. And very fortunately, out of the 700 passengers who landed in Taiwan, we didn't identify any secondary infection out of the passengers. So this slide shows how big data digital contact tracing were developed using big sensor data that could explore passenger routes. And also we send mobile messages to people who might have in close contact with those individuals at high risk of infection. Later in March and early April, we have another clusters happening on the Navy warship, Panshi. Again, digital contact tracing were deployed to follow up the 700 or so soldiers and sailors. And very fortunately, there was no community cases associated with the two clusters. So the use of big data and technology was a reason leading to a very successful early containment measures. This is described and raised by a JAMA article. So Taiwan not only has the ability to contain local epidemics, but we also have the ability of helping other nations in various ways. On June the 7th, after 8 weeks of zero community cases, the Central Command lifted the restriction on social activities restraints. So we enter a new era of life called the new wave of COVID-19 period of life. We encourage people to wash their hands, wear masks, and keep social distancing whenever possible. Whenever you enter locations such as healthcare facility, you have always need to check your temperature, put on your mask, and wash hands. The government also provided economy relieving packages for individuals and business, especially those who are suffering badly during the epidemic. We also have several domestic tourism promotion packages. They were launched to boost travel consumptions. And last month, we launched the domestic island hopping cruise around those tiny islands around Taiwan. It makes Taiwan the first country in the world, I believe, to allow cruise ship services to resume after the pandemic. So in summary, Taiwan's effective COVID-19 containment could be contributed to 4 factors: a very fast and proactive response early on, transparency and trust in all policy-making processes, frequent and effective communications, and finally, the use of big data and technology. So that's the end of my talk. Thank you very much. Stop掉，看这里，有，你声音这么没打开？正常的那个，我说日常的。
Thank you very much for your presentation, Professor Matthew.
Thank you.
Very interesting and very attract all of us. We know that Taiwan is not only flatten the curve of COVID-19, but keep the confirmed case below 500.
500, yes.
Below 500.
Yes.
Even though it has been more than 2 months, its first case, and less than 1% of 60,000 tests that it has conducted so far have been positive in the first time Taiwan saw these cases. So very, very little cases and good to handle the COVID-19 in Taiwan, I think. So for the next presentant, in this time is Mr. Kun Hitsai, CEO of Plus, with the topic New Trend of Telemedicine in 2020, Digital Stethoscope Application in Critical Care Medicine. The time is yours.
There's some questions posted. I think we will answer the question in the end during the discussion. Will that be all right? Okay. So we'll proceed to the second lecture. 那你要讲。
先有一批人开个头，然后我再 present 我的产品。
So we will continue with the question.
Yes.
Please
Okay.
wait.
Is there any question from academic hospital?
Yeah. Before starting, we want to share you a video just about now using electronic stethoscope in Taiwan University Yunlin branch.
要先共用，
你要先共用，
要先共用，从共用的画面选择你的档案这样子。
Yeah, this is collaboration with the Magic.
确认一下，
Sorry, we cannot see in the video.
You cannot see the video. Okay, hold on.
Okay.
We will.
点上面那个共用，然后你刚刚那个要点那个共用，先把它关掉，然后有一个上面有一个共用的地方，共用，然后共用内容不是共用会议视窗，
共用内容，
要共用内容，然后点出那个内容，点那个对共用，你要共用到那个，然后这时候再按 play 这样，然后再确认一下有没有看到。
Are you seeing the videos now, Professor?
Yeah.
要确认一下。
And this is about the video of COVID-19 using electronic stethoscope in the quantity room. And we are the first one in the Taiwan hospital universe hospital. And the nurses were wearing clothes, APS. Yes. Because traditional stethoscope can't use in a quantity room, so electronic stethoscope is very significant of non-epidemic scheme.
没有问题哦，我们听清楚了。
And nurses is inside the quarantine room and the doctor is outside the room. So the doctor can hear the heart sound from the outside.
好，现在帮我到你的外区。记得很清楚哦，脉搏功能正常哦。现在帮我切到肺的模式，然后开始呼吸。而且病人深呼吸。呼吸正常，然后等到左前胸。可以收一点这个大的。好，第二呼吸，要什么问题吗？到等到后面，一定要后侧。好，第二个清楚，可以换右边了。好，没有问题。好，我们听清楚了。
可以。
This is the second scenario, and the Dr. Zhang is wearing the ear tubes and dressing up and going to the community room.
我们两个一个，如果是医生在外面，护理师就传过去，就放个是一个，对，他如果他自己进去之后，他就带来他自己，对对，进去就一个病人给他一套，他觉得是套。啊？哦，对对对对对对，啊，对对对，
啊，超刀的。
对对，我是导演。
Thank you, everyone. Now we are inviting our CEO, Dr. Tsai, speaking, introduce to us. Hi, here.
Yeah, everybody, thanks, Professor Ma and the NTUH doctors and everybody joining this meeting. I'm Peter. It's our honor to introduce this medical equipment solution to prevent COVID-19. So if it could work for the protection of the nurses and the doctors to apply the application to protect themselves when they approach the patient in the isolated area. We think it's very significant. Yeah, in addition, we can provide a very useful wireless transmission from the auscultation. So if you can utilize this solution to collect the patient's breathing sound or heart sound in addition to the ordinary care, we think it's very useful. So if you can train the patient to use this digital stethoscope in the isolated area themselves, so you can approach and collect the breathing sound, heart sound every day and every time you want. So in addition, we have the artificial intelligence cloud system. So if we cooperate with Indonesia, it's our honor to install this solution to the individual hospital or some individual government cloud. So yeah, we can embed some artificial intelligence algorithm calculation in the cloud. So it's our honor to introduce this one. So Lauren Chen is our business development manager. So if we can do for everybody in Indonesia and Taiwan, it's our honor. We introduced this digital stethoscope. We not only US FDA, but also CE and the Japanese PMDA. So we had get the certificate clearance. So if we can cooperate with some certain guys or some distributor, yeah, it's our honor. Previously, I worked in ICU and the emergency room as a medical doctor for about 15 years. Now we have this company, iMediplus, to develop the digital stethoscope and the wireless ECG system, yeah, for the telemedicine care and the artificial intelligence. So if we can cooperate, we can share some information to all of us. Yeah, Lauren, do you have our company's introduction, like the corporate introduction about our writing and introduction?
Thank you, Mr. Peter Singh from NUH. Okay.
We
have a presentation. Hold on a second.
Okay.
Another video again because it's more convenient and like easy, the devices.
More video from.
This is our this is our brand Cardiac, and
Cardiac is dedicated to developing a stethoscope of high sound quality. With a group of well-known cardiologists, emergency physicians, and acousticians. The combination of superior sound quality with rigorous manufacturing process clearly and immediately aids physicians at the critical moment. Reviving the art of auscultation in Mengupas. Instant upload of patient data facilitates the consultation between ER nurses and physicians. The patented organ map details the sound recordings. The organ position is simultaneously recorded during the auscultation. There is a total of 32 positions for 4 organs, including 6 positions for the neck, 5 for the heart, 12 for the anterior and posterior chest, and 9 for the abdomen. Reporting to the visiting staff about abnormal situations which occur during ward rounds or asthma follow-ups. Sound filtering and frequency selection highlight the pathological sound. The technology of frequency separation reduces environmental noise and accurately records various organ sounds.
Just created langsung and hostile.
The bell mode, B mode, is suitable for oscillating heart sounds, 20 to 200 hertz. The diaphragm mode, D mode, is suitable for oscillating sounds from the lungs and other organs, 100 to 500 hertz. Visualized phonocardiogram helps identify heart murmurs. Performing real-time sound waves to visualize auscultation helps doctors identify heart murmurs more easily. Teaching and interpreting patients' condition by sharing heart sounds via an external speaker. 28 decibels of oscillation amplification facilitates the recognition of heart sounds. Physicians can listen to every subtle sound and can also connect an external speaker for teaching and sharing. The exclusive feature of DS3011A Premium that allows for storage and sharing of recorded auscultation sounds facilitates consultation and teaching. Up to 160 10-second recordings can be stored to create records as well as share. All recordings can be transmitted to a personal device via Bluetooth for reviewing. What's more, connecting to a speaker to instantly share the oscillation makes consultation and teaching more accurate. Application and routine screening for children with congenital heart disease. Phonocardiogram, display assist and diagnosis. Assist in diagnosis of heart diseases. Improvement of detection rate of congenital heart disease.
Thank you.
That is the last video or not?
Yes. Yes.
Actually, we have, but I think no time for it.
Okay. We know that the stethoscope is a medical acoustic device which is used to auscultate internal body sound, mainly in heart and lung. Now, we know that digital stethoscope is overcome the limitation of a conventional stethoscope as the sound data is transformed into electrical signal from your slide, from your video. Very high technology. Okay. Okay, we continue the discussion with many questions in this forum. First question is from Mr. Aziz from Academic Hospital Gajah Mada University. This first question is, according to sunmedia.com, Indonesia now ranked in fourth worst worldwide in dealing with COVID-19 pandemic. Based on your experience in working with Xavier Hospital and medical faculties Indonesia, what is your suggestion for us? Mr. Matthew, can you answer the question after you working with Xavier Hospital, several hospital and medical faculties in Indonesia?
I think all different countries are different stages of the pandemic, and the Taiwan experience probably is very difficult to be replicated. Probably only Taiwan and New Zealand. However, we do have.
Ini ngumpul wangi. Berapa ini? Kalau yang ini? Tapi nggak gumpal, nggak wangi.
Okay, we do have examples of suppressing the pandemic very successfully. The example from Korea and Singapore and some of the European countries is that you have to vigorously testing people, treat people, and isolate them. This is on the healthcare realm. So you control the pandemic, and your hospitals and the health system won't be inundated or collapsed. The other very important thing is community level, people practicing very good hygiene practices, just hand washing, social distancing, and wearing a mask. We have a statistic simulation saying that if in the society, if 65 to 75 of the population could abide by these rules and wearing the mask, then the disease won't be able to replicate. It won't spread out. So I think there are two perspectives. One from the healthcare perspective to treat the patient and also protect the health system. The other in the community is the practice of COVID-19, the new era of lifestyle, social distancing, hand washing, face mask.
You know that World Health Organization a few days ago, Tedros said that we have to avoid 3 Cs: closed space, crowded place, and close contact setting. This is the good comment from Tedros World Health Organization.
Okay.
So we continue to next question, Professor Matthew.
Yes.
Aren't there people in Taiwan who don't believe in dangers of COVID? If yes, how do you deal with them? From Mr. Aziz.
I think the reason why we had a very successful community-wide containment program is a very transparent policy making and all the communications from the central command to the people. So we actually have very high level of support for these containment measurement, including social distancing and facial mask, wearing social mask. For example, in highway, in high-speed rail, in the rail train, in subways, in buses, you have to wear a face mask. If you don't wear a face mask, you'll be thrown out of the vehicle. And yes, we do, but we also have a strong regulation. I don't say punish, to regulate those people who are not practicing these very important measures. For example, if you are under house quarantine a period of time and you violated, you got caught, you could be fined dearly.
Okay, thank you.
We are not the community. Because I read some of the news. People in some country, the young people, they are throwing out this COVID-19, parties, so people get infected. We don't have crazy people like that in Taiwan.
Okay.
May I add something about this?
Okay.
I think the public media is a very important. Yeah, for your questions, I think the public media is very important too. Because the communication between the experts and the public sometimes is difficult. So we use different public media to communicate with the expert, not the government, because some people, they just don't like the government. They don't like the officers. But then we ask the doctors, the infection specialists, to communicate with our people. And then some other media like the apes, using their mobile phone. I just received a message from the government, the Central Epidemic Control Center, how they struggle and fighting with the rumors. And because every day they renew everything, the knowledge and the current status, and then every people know that what is the truth. So that's a very important step to enhance the public awareness of COVID-19. When people, they don't believe the dangers of COVID-19, the other people will teach them, will educate them what is the truth. So even in the beginning, we had a few people, they don't like this control regulations of to prevent COVID-19. They violate these rules in the bus, in the train. The other people will teach them, will ask them to follow the rules. Otherwise, the other people won't be very happy with that. So that's I think that it's a lot of the herd immunity. Herd immunity to against the virus is not only the antibodies, but also the concept of the people. So that's I want to add.
I also totally agree with Professor Chu. I think it's a widespread consensus. Everybody should practice these containment measures.
Mm-hmm.
And if you violate these measures, you will be sanctioned by the community. Sometimes to the extent, I think it's too strong. I mean, it's a little bit violate like personal liberty. But actually in Taiwan, there's very strong consensus. Everybody should follow these instructions, fortunately.
Okay. Taiwan has effective risk communication to build trust and confidence and reduce panic from these that people. We know that Taiwanese on his social platform, they make sure the people that the government of Taiwan can reduce and protect the COVID-19 with confidence and trust in the government and ability to handle the virus. Okay, the next question.
Okay, good.
Next question. This is from academic hospital. How about low herd immunity issue in Taiwan? How to protect the next wave of transmission?
We have zero herd immunity.
Yeah, zero.
Almost zero.
Almost zero.
There was a community zero prevalence studies just released 2 weeks ago. I think the prevalence among not the general public, among the high risk individuals, those in close contact with the home quarantine, in close contacts with the confirmed cases, and also hospital staff, the positive rates for neutralizing antibodies for COVID-19 or SARS-CoV-2, I think it's 0.4 per 10,000.
Mm-hmm.
It's very low. It's very low. So the zero prevalence is almost zero, and that means we have zero herd immunity right now in Taiwan.
Mm-hmm.
So the next, how to protect, very strong border control, very vigilant case identification at the hospital, healthcare, because, although there are a lot of asymptomatic patients, but at least, 60, 70, 80% of these patients will get symptomatic. So although we have very few cases so far, we need to keep very high alert on potential cases to pick them up at the healthcare facility. And the other things is before the arrival of effective vaccine is good containment measures, social distancing, good hygiene practices.
Yeah.
Okay.
Yeah, for a community with very low herd immunity, the only possible way to protect the next wave of transmission is waiting for the true vaccine, the effective vaccine. So we are now speeding up our vaccine development program in our country.
Okay, the next question is from Dr. Mainani. It is interesting your slide regarding humor and rumor. How do you manage it, especially to prevent rumor? This is the same question. Could you explain how the coordination between the hospital, district health office, and community?
Yeah. Okay.
So the question is, how do you manage it, especially to prevent rumors? I think Taiwan is learning how to deal with disinformation from the political aspects. We have the presidential election just ending this January. And 2 years ago, we have a very vibrant election for the county and city mayors and all the legislatures. And like anywhere else in the world, what's happening in Europe, what's happening in North America, is these political campaigns are so full of disinformation, a lot of rumors. And we actually got a lot of experience in dealing with political rumors, starting from finding the source of rumors and cutting the spread of the rumors. The way you deal with rumors or disinformation is actually very similar to contain an infectious disease. Sometimes you cannot stop it from happening, but once you notice some of the disinformation is spreading, you have to cut the chain of spreading. So on that aspect, I think Taiwan worked very closely with international different countries and also National Security Council. Our national security bodies are actually working very closely to detect internet rumors. So on one hand, we try to dissolve these rumors using transparent, frequent communication people like the Mimi. But the other way, behind the door, is high-tech strategy to deal with disinformation, cut the roots, cut the spreading from internet.
Okay, thank you for the information. I think the answer is very clear. 3. Next question. This is the question from, we cannot see in the PowerPoint. We already knew that clinical students or co-assistants are still focused on their study. How far they permitted to contribute regarding the pandemic in Taiwan?
Yeah, actually in Taiwan, the clinical students and co-assistants are protected. They were protected from this pandemic. So we postponed our semester 1 month later in late February to March, until we confirm that all the hospitals, the practicing places are all safe. Then we started to allow them to have an internship and clerkship in our hospitals. So once we have any signal, including the ICUs or the infection control wards, once they have this signal or the suspicious cases, we just ask them to leave the hospital in some wards. So actually, we don't permit them to. They are not allowed to contact the patients directly until we confirm that we are all safe. So actually, in our hospitals, we have done several times of serology and PCR testing for our staff. And we finally found that there's no issue of contamination in our hospital. Now they work as usual. So we start our semester, and all the medical students and interns and PGYs, they're now working with us. We don't have any issue about that.
Okay. In last 8 days ago, I saw the data from Indonesia. There's many reactive COVID-19 cases, more than 25 positive rate. And we know that the World Health Organization showed the standard for positive rate for COVID-19 is under 5%. can you suggest for me for the Indonesian condition about the increase of COVID-19?
If the percentage is so high, that means the population base is not correct. That means the possible cases in all the COVID-19 cases are higher than the reports. Because generally, if you have more cases, the severe cases are fewer. The percentage of the severe cases are fewer. So that means the denominator and nominators, the calculation has some bias from the reported cases and underreported bias. So I think that regular detection of the high-risk suspicious cases are essential to protect the further transmission by these high-risk patients. And then we can ensure that the other people are safe, can be quarantined. All the suspicious cases can be quarantined adequately without further contamination or further transmission to the other people. So I think that to enhance the PCR detection rate and the performance of the PCR detection will be very important in your country.
Okay, thank you for the answer. We know the data that Taiwan have just a few little cases of COVID-19. I saw the data in March 28. Taiwan have 23 cases confirmed COVID-19, and April the highest cases is 22, just 22. In May 6 cases. In August 1 August 7 cases. And September just 1 cases. So the total cases in Taiwan is 489 with 7 deaths. I think this is the data is very incredible, and your effort to better condition is very, very good. So would you please to give the advice for Indonesian government to decrease the case of COVID-19?
I think it's very difficult to give advice, but we have some suggestions or recommendations.
I can give the data that the 8 days ago until this day, the cases of COVID-19 in Indonesia more than 3,000. In 3 September, 3,622 cases. With the positive rate is about 8 days ago is 17.1%. So it's very high for me. And how can the expert from National Taiwan University Hospital can advise the case?
I think it's more difficult in Indonesia than in Taiwan because we are a big country with so many people. So the public awareness is a very important step to decrease the positive rate. Even doctors, you work very hard. You try to educate and teach your patients, but sometimes the public awareness is not so high. Then more and more cases, they cluster together in the community base, not in the hospital base. So the nationwide education, nationwide public media awareness announcement, and also because we know that you have many items. Some people they don't watch TV or they don't have the newspaper. You may need to use your mobile phone, the apps, to communicate with the general population, to let them know the importance of the quarantine. And once you have any suspected symptoms, please go to the right place to do the serology test and PCRs. That will be the only way to control this rate of the disease. Otherwise, it will be very difficult for you.
Indonesia has many population, 270 million, and Taiwan is 23 million. I think very high disparate population, Taiwan and Indonesia. And we continue the next question. From my senior, Dr. Maya, how about the virus mutation in Taiwan? Does T6140 mutation also exist in COVID-19 patient isolate?
Yeah, we do have different mutation strains, and we can also trace these mutation strains from their origin, because most of our cases now are all imported, traveling from the other countries. So we have the Japanese strain and many Chinese strain from the original Wuhan city, and then Cantonese and Hong Kong strain from the beginning in February, March, and then in July when we have new cases, we also isolate the same strains. And also we have some strains from Europe and from very similar to the Italian strains, and then they spread to the Middle Asia. Because we have many flights, they just have transmission during this Dubai airport. So very similar change as has been reported in the literature. So we also isolate most of the strains. Yeah.
I don't think I have learned anything about the existence of this super spreader variation in Taiwan yet. Yeah. But we only have very few cases coming out of from out of country, and there's no community spread. So I believe there's zero virus, well, at least close to zero in the community. And so far, there's no report or any confirmation of this new variation or like very highly contagious variation in Taiwan. Not yet.
Okay, thank you. Many questions come to me, and I will ask about how about vaccine in Taiwan?
Vaccination development is one of the top strategic issues in Taiwan. I believe there are 2 or 3 research institution together with a vaccine company are developing it. I think one of them just got the Taiwan FDA approval for the next stage. But I think everybody's working and everybody's anxiously watching who will be the leader, and we don't want to be left out. But so far, we don't think we have a magic bullet yet. We probably are developing. We heard something about first phases, early phases success, but not yet.
I know the Taiwan developed the rapid test kit, vaccine, and vaccine. When Taiwan will announce approximately time for vaccine?
We don't know it yet.
I hope it could be tomorrow, but it will be quite some time.
Yeah.
Okay, thank you for the information.
Thank you.
Okay. Any question for the audience? No question for the audience.
Dr. Wahyu, can I ask because?
Okay.
Professor Chu, nice presentation. Your team, nice presentation from your team. So we know that the case of COVID-19 in Taiwan is very low. So what is the condition? Are you also enter we call new normal, or without new normal, because you have no at the moment maybe there is no COVID-19 cases, yeah, in Taiwan. So you enter the new normal, or what is the condition now in Taiwan? And the second, I forget the question. The second, the second, how about in the school? Yeah, is it already open or not? And is it COVID-19 pandemic in Taiwan influence the patient in the hospital? It means that the people afraid to go to the hospital. Okay.
Okay, I think it's we just entered the new normal since July. Actually, our school never closed during this pandemic. We just postponed the semester for 1 month, and then they reopened. We start our semester in mid-March, and then we continue all the educational activities until the mid-July, and then we enter the summer vacation. And since June, almost all the activities were getting normal, and we can hold any face-to-face in-house conference and meetings in our daily activity. And actually, all the patients came back after May. So in March, in April, we reduced around 20% of patient visits in our outpatient clinics, and also the emergency visit. But actually, there is a rebound of patients. And today, I just ended my morning session of consultation. I faced 90 cases this morning until 2:30. So I just came from my clinic. So I think that everything is almost normal, unless we need to wear the facial mask every day. And during the transportation, during the bus, in the train, we must wear the facial mask. Otherwise, we will be asked go out from the bus and the train. That is a public consensus for all country. So everyone should wear your mask when you get into any public transportation tools. Yeah, I think that's the only difference.
Okay.
Any question for the audience? No? We don't have the Taiwan manage that finished without lockdown. School were only closed for 2 weeks in February. All right?
Yeah. Yes.
How about the games? The games is already restart in April.
Yeah.
The game resumed in May.
yeah, the baseball game.
How about football?
We are not crazy about football. We have basketball and baseball.
And baseball.
Oh, baseball. Okay. Any question for the audience?
How about transportation, Mr. Professor Chu, from abroad and transportation? Yeah.
Concert. Yeah, we reopened the
Transportation.
How about the transportation in Taiwan during pandemic era? How about the transportation in Taiwan during the pandemic era?
Everything is normal. We can get to the train, the high-speed trains, and bus. They work operate as usual. The only requirement is you must wear your mask before entering the train and the bus.
How about the prevention to the transmission from the abroad, like the international transportation, like that?
Yeah, the abroad. Yeah, we have border control is very tightly controlled. So you must apply and provide the negative PCR test within 3 days of boarding, and then after arrival, you must do the PCR test immediately, and then go to the quarantine hotels for 14 days. And then we will repeat the PCR test for twice, and they will confirm that all the tests were negative. then you can allow to go outside. So that's a general requirement for all business travels and government and ambassador and diplomatic travelers. So that's a general requirement. It's still totally controlled.
Okay, thank you for the answers. When we think about the transportation, like what Mr. Arif say, there is the regulation in this transportation that any like stay at least 1 meter in class like that.
听不懂了是吗？ Regulation.
Stay at least 1 meter away from the others.
Oh, yeah, social distancing.
Social distancing, 1.5 meters.
But our regulations. But if you cannot keep 1 meter or 2 meters, you have to wear masks.
Oh,
If
yeah.
you wear masks, then there's no need to separate people. We also have different guidance if the people in the room, you know each other, like I come here and I know Dr. Chu, I know my party, we assume this is safer. If you go to a room with a lot of people you don't know who they are, you have to wear masks.
Yeah, okay. The message from your answer, I think the first is stay at least 1 meter away from others if we don't use mask. Okay?
Yeah.
Clean our hands regularly. And there is any hand sanitizer in
Yeah.
transportation?
Yeah. When you get into the train station, the bus station, we have the hand sanitizer.
All those spreading, the auto spread, so
Yeah.
you can get the alcohol spray.
And in restaurants. Yeah. Also the same.
In public.
Yeah, in public.
Practice respiratory etiquette and wear mask. I think this is your message from your answer from Mr. Arif, Dr. Arif.
Yes.
Any question from AHS hospital, academic health system, hospital? Maybe there is so a few time to discuss for these cases. Any question? No question? Okay. Thank you very much for our honorable speakers, Professor Matthew and Professor Cha Yushu and Ms. Kun Hisei, right?
Yes.
Yes.
Thank you very much for time and participation for the audience now, and hopefully we can meet again in the next time. Okay. Thank you very much for your
Thank you, Prof. Chu.
explanation.
Thank you very much for having us.
I hope we can see the next seminar. Okay. Thank you very much.
Thank you.
Thank you. Terima kasih.
Terima kasih. Ya.
Terima kasih.
Terima kasih.
好，擦擦就可以了。
好，谢谢。